Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullah. We are going to discuss aplastic anemia. The word aplasia means no synthesis or absence of production of cells. Pancytopenia means stop of synthesis of all or decrease number of all the blood cells lines, namely the RBCs, the white blood cells, and the platelets. So pancytopenia is reduction of the blood count for all these cell lines. It has several causes categorized into two. Number one, decrease bone marrow production, or number two, increase peripheral damage or destruction. Causes of pancytopenia are so many. Number one, decreased bone marrow function due to any cause. Number two, aplasia, which is reduction of hematopoietic stem cells, the mother cells, which are responsible for production of all cell lines. Three, acute leukemia, myelodysplasia, myeloma, or these malignant blood types may. Number four, infiltration with abnormal cells like lymphoma cells, solid tumors, and tuberculosis, because the site of production of cells is the bone marrow. When the bone marrow is full of or infiltrated by abnormal cells, no area to produce normal cells will occur or will be present. Number five, megaloblastic anemia. In megaloblastic anemia, due to deficiency of B12 or folate, we have reduction in DNA synthesis of all labile or rapidly dividing cells like blood cells. So also it is one of the important causes of pancytopenia. Number six, paroxysmal nocturnal hemoglobinuria. Also there is abnormality in cells destruction. There is destruction of cells due to abnormality of RBC's membrane, leading to problems in destruction of cells. Seven, myelofibrosis, then hemophagocytic syndrome, and increased peripheral destruction due to autoimmune diseases like SLE and rheumatoid arthritis. Splenomegaly, also by pooling of a lot of blood inside the spleen, a lot of cells will be trapped there, and a small number of cells will be circulating around all the body. This also will lead to pancytopenia. For aplastic anemia or aplasia, the problem is inside the bone marrow. The problem is in the synthesis of blood cells inside the bone marrow. So there is hypoplasia or aplasia of synthesis of blood cells, resulting in a decreased number of all cell lines, the RBCs, the platelets, and the white blood cells. It is classified into primary or secondary aplastic anemia. For primary aplastic anemia, it may be congenital, occurring early. Examples for this is Fanconi's anemia. Number two, idiopathic, acquired without an obvious cause. Secondary causes are many. We have ionizing radiation, chemicals, drugs, and the drugs. There are drugs which are usually routinely result in bone marrow depression, and others which are rarely causing this problem. Viruses like hepatitis viruses and Epstein-Barr virus, autoimmune diseases like SLE, transfusion-associated graft versus host disease. This 9 is by mistake. It's not GVHD9, it's just GVHD, indicating graft versus host disease. And here the lymphocytes of the donor will attack the body cells of the recipient. Number 7, thymoma. This is a tumor of thymus gland, and it is usually associated more with pure red cell aplasia rather than aplastic anemia. This is a bone marrow of aplastic anemia, and the number of cells is so much reduced. The bone marrow is on the right side, we can see, is largely replaced by fat cells. These empty spaces are fat cells. In the usual bone marrow, the fat cells comprise about 50% and the cellular part of the bone marrow comprise the other 50%. Here, almost